Hi, I'm Dr. Heather Rice from Wellspring Chiropractic Lifestyle Center. Today we're talking about how do we support our patients if they're struggling with sciatica in between visits. So when they come in for their adjustments, we want them to be doing things that are going to support the work that we're doing so they don't lose ground in between visits. We have found that when the sacroiliac is involved, when there's an instability there, that the sacroiliac belt is a wonderful tool to use. And that belt, it actually is worn low around the hips. It's not a lumbar brace. Many people think that lumbar braces are what are going to help their sciatica, but what we have found is that the lumbar braces cause atrophy of the muscles in the lumbar spine, the core muscles. And so we prefer not to recommend those. Studies also show that there are more severe injuries using the lumbar braces than when using the sacroiliac support belt. And so this is worn low around the hips, and we tighten it right up, and it acts as a ligament so that your ligaments can heal up properly around those sacroiliac joints. So that's a great tool for people to use. You can actually wear it 24/7. It doesn't interfere with muscle function. And I have people that sleep in it so they can get better sleep if it's uncomfortable sleeping. I have people that swim in it, right? So you can wear it 24/7. It doesn't interfere with any muscle function. It's a great tool. We also know that the curves in the spine are very important to support. So as we're trying to restore a proper forward curve in the lumbar spine, we want to send people home with tools that they can use. And so there is something called the lumbar decompression pillow. And so this pillow is something that it's a small square pillow that we're going to now use a hand pump, and we can pump it up with enough air so that it actually pushes up against the curve in the lumbar spine and starts to restore that proper curve in the spine. And if somebody is struggling with disc issues, this can also act as a bit of a traction device as well to take some pressure off of the discs. So we really do want to restore the proper biomechanics to that lumbosacral area, and having a proper forward curve in the spine is essential for that. So the lumbar decompression pillow is very useful for that. We also find that people have trouble sitting very often when there's sciatic problems. And one of the reasons is that their spine is not being supported properly when they're sitting. There are two factors here. One is we often find that when people are walking and moving, that tends to be a bit easier and they tend to get better results. And so what if you could actually be moving while you're sitting? That actually may give you a bit of a benefit. So there are pillows that we have. This one is the Back Vitalizer, and we have you sit on it, and it's actually blown up with a little bit of air in it. And when you sit on it, it's almost like sitting on a physio ball or a therapy ball that people have used, where they actually have movement in the spine as they're sitting on it. We also can use this behind their spine, and leaning back against it, it actually helps to reinforce that proper curve in the spine. We have some that are more sophisticated for going behind you and going under you. We can explain more about that on your visit, but basically this is the idea of using these Back Vitalizer cushions to support the lumbar spine. And we even have some that are good for, they look like just throw pillows, something you might find on your sofa or your cushion or an easy chair, but they actually have, again, you blow up a little bit of air into them, and when you lean against them, it supports the spine in a beautiful way. We call these the chi pillows. So we have these in the office because we want to support people so that in between visits, they don't have any setbacks. The idea here is every time we adjust somebody, we want to take 3 steps forward, and then between visits, we want no steps back. So the support is essential there. I hope that you found this useful. If you know anybody that's struggling with sciatica, these are tools that could help them. And if you yourself are struggling, click on the link and we can set up a consultation and I can find out whether or not I can help you. All right, I hope to see you soon.